It's 10:30 at night, and 4-year-old Shanvi is fast asleep. Her mom, Kavita Upadhyay, gets ready for her night shift at a nearby factory. The buses can be crowded, so her husband drives her to work, and they can't leave Shanvi alone.
There are a lot of people using the bus, and we have a kid, so we don't want to take that risk. It's better to be safe than to be sorry.
Everything they do is about staying safe, because living and working in Brampton means confronting risk every single day. The story of one of the hardest hit areas in the province can be told here, at a bus terminal where thousands of essential workers set off to dozens of factories and warehouses in the area. There have been hundreds of workplace outbreaks since last year, fueling more than 100,000 COVID cases in the region. Infections that spread in densely populated buildings and in homes with several family members. The effects can be devastating.
I can't make my balance. Whenever I move in my house, always somebody's watching me that I don't fall.
It's taken weeks to manage a few stairs. Gurinder Singh Khera is recovering from COVID, and he's lucky to be alive. Twice he was rushed to hospital and put on a ventilator. The second time, he says, he barely made it there after collapsing in his bedroom.
Finally, I'm gone. I'm nowhere.
What do you mean you're gone?
My body get almost cold, no breath, no heartbeat. So my wife started crying. My mother-in-law is downstairs. She ran upstairs. My daughter, she called 911. They gave the instructions, press the chest and whatever. They try to do it, they do it.
Gurinder's wife works at a factory where there have been outbreaks. She got sick first. Other than his daughter, everyone at home, including his in-laws, got infected. But no one as seriously as him. He says his wife is traumatized by how close he came to dying.
I feel it, she's scared. We never go to the bedroom. She's scared. Both times I go to the hospital from that bedroom. So we sleep in a family room. And what I feel for my family, that we go through the hell. If somebody says go to hell, I see the hell, honestly. So that's why I say to everyone, use precautions. If you don't need to go outside, don't go, honestly. I'm very lucky.
I'm a merchandiser, I'm a cashier, I take passport photos, I deal with customer service, I do a little bit of everything. People aren't aware. They come straight up to our faces to ask us questions or to show us something, or they follow us like literally right behind our back. They don't take into account that, you have to be far away from us. Sit! I know you want more treats. Sit!
Michaela Portali works part-time at a pharmacy and has been on her guard since the start of the pandemic.
Give Mama a kiss.
It's been one anxious shift after another.
I've put wet floor signs all around me before just to get people to just stay away from me, but they actually kicked the signs down and they came right up to me, which it kind of broke my heart and it just made me so scared.
Michaela got COVID this past March. She suspects she got infected at work.
It's okay.
She's still recovering, but her grandparents, who lived with her and her mom, also got sick. They both ended up in hospital, and both died within weeks of each other.
And it took the lives of people that didn't deserve it.
Michaela is still reeling.
And to know that it could have came from somewhere that I was working from, or someone that came too close to me, it breaks my heart. Because people don't realize how much damage they cause. It's hard to lose people when you're so young. I mean, all I had, they were in my support system. And to possibly know that I was the one who hurt them by bringing someone from my work. It's hard to live with myself.
Yeah, okay. Let's run.
It's been stressful. Mentally, you keep thinking you have a kid and things can go in any way. You cannot predict the course of the disease. Run, 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 run!
Kavita and her family have dodged COVID until now. There have been outbreaks at her workplace, and there are cases in her building too. She focuses on the joy in her life and gives thanks for every healthy day.
Some people are badly affected, some are very mildly affected. By God's grace, we have not been affected. But I can only be thankful to God and just take precautions.
Kavita and her husband just got their first vaccine dose. And while going to work is still a risk, the danger is starting to feel a little less dark. Joanna Brumaliotis, CBC News, Brampton.